Hi there, my name is Sylvia North. I am a New Zealand registered dietitian and representative from Coeliac, New Zealand and the Medical Advisory Panel. This presentation was brought to you by Coeliac, New Zealand and the Medical Advisory Panel, and for more information about how we support those living with celiac disease in New Zealand, you can follow either of these links to the website. So in this presentation, we're going to talk about diagnosing celiac disease. And diagnosing celiac disease usually takes a number of steps. And there are a few sort of important things to know about following a normal gluten-containing diet and when to start your gluten-free diet throughout this process. So we're going to talk about the initial role of your general practitioner and the blood test that you would go through, the gene test that is available, which is sometimes used to screen or to rule out, and the endoscopy and duodenal biopsy, which is a procedure that a gastroenterologist must perform to confirm your diagnosis. So let's get into it. So firstly, just to summarize the whole process of diagnosing celiac disease, you have your general practitioner, your primary health care provider is the first person you will have a conversation with about your symptoms. And so it might be that you show up to your doctor, so with tummy pain, there's some bowel issues, there's some diarrhea, there might be anemia, a previous blood test might have shown iron deficiency anemia, you might have ongoing unexplained weight loss and fatigue. So if some of those, and your doctor will be really well aware of sort of the clusters of symptoms that they typically see in celiac disease. So if this is the case, then there's a initial screening process, which is a blood test, and so there's just a normal blood test that you'll do for your doctor. There is also a genetic screen, which is sometimes used, and then the final step, if either of those indicate enough suspicion, you'll receive a referral for a confirmation diagnosis with a specialist. So first step, when you show up to your primary health care provider, we covered these in the first webinar. We talked about symptoms associated with celiac disease, but it might be any of these: vitamin deficiencies, poor healing, irritable bowel, extreme fatigue, and brain fog is really characteristic. Another one that's less well known is fertility problems or miscarriages. So that might be a point of call for screening for celiac disease in some people. And so what happens is once you show up to your doctor with these symptoms, then you're referred for a blood test. So your blood test tests for two things. It tests for your total IgA and your anti-TG2 antibodies. So what these blood tests show is they show how much your immune system is reacting. And these antibodies in particular are the antibodies known to be corresponding to the celiac gluten reaction. Now, because this blood test measures a reaction, one of the problems is it can show up negative if you've already started a gluten-free diet. Now, this is a really sort of common funny place in practice, because a lot of people might already suspect celiac disease or might already have suspected an issue with gluten but not necessarily thought of it as celiac disease before they had the blood test and before they showed up to their doctor. So it can show up as a negative if you're on a gluten-free diet. So what's generally advised is that you do stay on a normal gluten-containing diet up until that blood test, or until blood test suggests the next step forward. Now there's another screen that your doctor can do, and that is the gene test. And sometimes the gene test is suggested if the blood tests are normal, but we still aren't quite sure if celiac disease might be there. And the other place that the gene test is used is to screen relatives or to rule out the possibility. So if you have one family member that's diagnosed, it might be worthwhile. There might be other family members where you just want to rule out the possibility of if it's worth monitoring them. Because then if you know someone else in the family has the gene, then they're going to be really adamant on regular checking for other signs and symptoms of celiac disease if it might develop at another stage in life. So once we've had our blood test, and let's say our blood test was high enough, so our antibody levels were high enough to show that there was an active reaction to gluten, the next step is a referral to a specialist and the confirmational duodenal biopsy. So the reason why a duodenal biopsy needs to be done is because we really need to it's the only way to show if there is active damage into the small intestine. So duodenum refers to the part at the top of the small intestine that attaches to the stomach. And so you can see in the image here, there's a cartoon of a lady. She swallowed a camera, she swallowed an endoscope. Well, she will have been sedated, she didn't just swallow it. And it's gone past her stomach to that top part of the small intestine. And so what they do in this procedure is they take a number of small samples of tissue from around the duodenum, and what we're looking for is to see if the small intestine had damage. So I'm just going to show you on this next image here. Now this is a slide, so a tissue slide of a healthy small intestine on the left and a celiac, seriously damaged small intestine on the right. Now there are some major differences here if you can look past the fact that they're both purple and both have lots of little spots in them. The difference here is A has fingers, B has none. B is a fist. And so what this and when they do look at these slides of tissues, they're also able to see where there's immune cells, where there's inflammation and swelling, and so this is sort of why a tissue sample needs to be taken to be able to see if there's damage. In order for this result to be really clear and really positive, someone needs to still be on a gluten-containing diet. So it is a lengthy process, particularly it's a very invasive process as well, having an endoscope. But if someone has already commenced their gluten-free diet, and this just goes to the power of a gluten-free diet, you might already start seeing some healing, and you might not see the same severe changes in structure in the small intestine. So why do I need to eat gluten before testing? I mean, it just sounds totally backwards, doesn't it? I just worked out that gluten upsets my stomach, and that's because the testing that we currently have only measures when there's a reaction to gluten, so it only is measuring for the damage, for the inflammation, for the immune response. And it becomes a little bit of a funny area because many people might have already removed gluten before they're diagnosed. And if that's the case and you want a confirmed diagnosis, you have to go through something that we call a gluten challenge. Now this is something that's really important to talk to your doctor and your specialist about when you're going through these process of testing. And a gluten challenge usually looks like reintroducing gluten into your diet for about between 4 and 8 weeks before testing. The amount of gluten that we need is the equivalent of about 4 slices of bread for adults or 2 slices of bread for children. So we can imagine for some people that can be really, really, really hard, but it is kind of required in order to get those reliable results. So the reasons why some people might go through a gluten challenge to have a confirmatory diagnosis is because if it is confirmed and medically recorded, some people do qualify for pharmac subsidies on gluten-free food products in certain areas of the country, which can become cheaper, and it also might increase access to certain follow-up testing, things like bone scans or blood tests more frequently than someone who wouldn't be diagnosed with celiac disease. So in summary, celiac disease is typically diagnosed in about 2 or 3 steps. The blood test isn't enough to confirm. It's more of a screen, and sometimes we use a gene test to also screen the possibility. Diagnosis can only be confirmed after a duodenal biopsy showing active damage to the small intestine. So we can only actually confirm that there is celiac disease when there is clear damage in the gut. For accurate results in either of these tests, you do need to stay on a normal gluten-containing diet. So it's really important to have a good, clear conversation with your doctor about what's required at the time and what you're capable of doing with your current symptoms, because everyone is really individual in how they can go about that. So thank you for listening to us today. My name is Sylvia North. I'm a New Zealand registered dietitian and representative for the Coeliac NZ Medical Advisory Panel, and I prepared this presentation with my colleague Margaret, who is also a registered dietitian and a member of the Medical Advisory Panel. Thank you.